Thank you very much, Keith, again, and thank you and hello to everybody on this Zoom conference. I apologise that I'm here a little bit later than I originally anticipated. As you can imagine, there is a new crisis every day with COVID, and I must report, and I don't think it's any secret, that currently the situation in Leicester and in Leicester hospitals is worse than in the first wave that we had back in March, April. We've got more patients in the hospital with COVID, and we've got more patients in intensive care, to the extent that, we're having to really look at services we would normally provide in the hospital. It really is very, very difficult at the moment. So that said, you can rest assured we're working very hard to keep things going and make sure that everybody's health needs are dealt with. But in case you're wondering why I was a bit late, it was because I was at a very important meeting looking at some of the actions we need to take. That said, I've been invited to talk about the COVID infection we've got and also the vaccination program. And given the audience we've got, given Silver Star's interest in diabetes, obviously, and also the high BME community we got in Leicester, I thought I'd just cover a little bit around how COVID is affecting the BME community, particularly the South Asian community, and also how it's impacting on people with diabetes. And I'm sure I just caught the end of Hina's chat there. I'm sure she covered some of this. But the data does show that COVID infections, BME communities, socioeconomically deprived communities and South Asian communities are much more susceptible of in terms of catching COVID and then developing the complications of COVID. And of course, that includes dying from COVID. And we've got quite a lot of evidence for that now. And the percentage is 40–50% higher in BME communities than it is in the general population. Now, why is that? I think there's a range of factors. There's no one factor which is responsible for the higher prevalence in South Asian communities. I think part of it's around socioeconomic deprivation. So, for example, you've got much more overcrowding, much tighter populations in places like Highfields and Belgrave than you have in the leafy suburbs. So therefore, the risk of the spread of COVID is much more. You've also got some of the cultural differences, so people visiting each other's families at home, and how that is really an essential component of our culture. So I think that has an impact as well. I think there's also the impact of the type of work that people do. So often people are in very public-facing roles, working for the public sector, working in transport, or working in factories where people are working in very close proximity. So all those have an impact as well. And then obviously comorbidities such as the higher prevalence of diabetes, cardiovascular disease, all those, if you catch COVID, may potentially make COVID much worse. So there's lots of reasons why South Asians are more susceptible to COVID and the complications of COVID. So the upshot of that is that we need to be even more careful. We need to pay even more attention to the messages around social distancing, around wearing masks, around making sure that we wash our hands, keep our windows open so there's plenty of fresh air circulating at home, which I know is difficult in the winter, and it's difficult when you've got a small house or an apartment in the centre of Leicester. But we need to try and do all those things. Those are really, really important. In terms of diabetes, the link is there. Diabetes makes you more susceptible to all sorts of conditions, including infections, the complications of infections, the complications of cardiac issues, because you've already have probably a degree of pre-existing heart disease or vascular disease. So if you catch COVID on top of that, it makes your risk of complications much more. So the messages there are quite clear. The experience in some of the countries, because South Asians clearly live all over the world, particularly in South Asia, is not quite so bad, actually. Some of the evidence from some countries in East Africa and South Asia shows that, in fact, just because you're South Asian doesn't mean to say you necessarily will have worse outcomes. Some of the outcomes in those countries are sometimes a bit better than even in this country. So it isn't purely about ethnicity. It's about all those other things I've talked about around your work, around your housing, around the way that you mix with other people. So all those things have a big impact as well. In terms of the solution, clearly the vaccination, other than doing the things I've said around social distancing, hand washing and so on, the vaccination offers us the biggest hope. And the evidence from the vaccination that we had so far, certainly the vaccination from Pfizer that's been approved, is that it works. It has an effectiveness over 90%, and also it's safe from the large numbers in the phase 3 trials, and also from the data we've had so far in terms of, I think over 200,000 people have been vaccinated now in the UK program. From the initial data we've had from initial experience we've had from that, I think it's generally a safe vaccine. And certainly healthcare professionals are queuing up to have it. Clearly we have a system of the vaccine going out in terms of going to the highest risk groups first. So we are focusing on people over the age of 80. Those are the people that we are bringing in at the moment. And that is happening in terms of Leicester at the hub at the Leicester General, and increasingly in PCN centres. I was opening a PCN centre today at Westcoats, and they vaccinated well over 100 people today at that site. So we're focusing on the over 80s, and then we'll move on to over 70s and people at really high risk categories. And of course, healthcare professionals, if we have spare vaccine, we are focusing on healthcare professionals as well, because we need the workforce. One of the issues in terms of the crisis we have in the hospitals is that a lot of staff are off ill, either with COVID or they're isolating or whatever. So we can get them vaccinated, that'll be really good. So certainly I would encourage people on this call, your family and your relatives, once you are approached by the NHS to have your COVID vaccination, then please come forward. The process is really quite robust. We make sure that all patients are safe to have the vaccine. They haven't got any risk factors that means that they shouldn't have the vaccine. For example, one of the risk factors is around having severe allergies to medicine. So that group of patients, we will assess you and advise you accordingly. Or if you're on anticoagulation, you'll be assessed and advised accordingly. But for most people, it'll be okay to have the vaccine. And you'll go in, you'll have your vaccine. The staff who deliver the vaccine will be trained in how to give it. There are particular ways that these vaccines need to be given, particular ways they need to be made up and then administered. And then people need to stay in the healthcare facility for 15 minutes, just so we can make sure that everything is okay, everybody's safe, and then they can go home. So we have all the right processes and procedures. There is no conspiracy here. Nobody is having chips put into them through the vaccine. There's no conspiracy in terms of trying to cause any other impact on patients, other than preventing you from getting this very, very nasty disease, which potentially, unfortunately, for a percentage of people has very poor outcomes. So please, when you are called for your vaccine, come forward. Only then, once we get enough people vaccinated, once we get all the high risk people vaccinated, can we then look forward to, in April, May, June, getting back to normality. Hopefully we'll have enough people immune from vaccination, and certainly enough of the very high risk people immune, that we can then say it is relatively safe to start going back to a normal lifestyle. So that is my plea to you, to take that message and give it to all your friends and family, and obviously take it on board yourself.